Buoy Health Insights, Clear, Odorless Ear Discharge. Hello and welcome to another episode of Buoy Health Insights. If you've ever experienced a clear, odorless discharge from your ear, you might have found it puzzling or concerning. Let's dive into what could be at the root of this symptom and when it might be time to seek medical care. Clear ear discharge may not be as common as the typical earwax that always has a bit of color and provides natural protection to your ear. When you have clear, odorless discharge, it could be a red flag pointing to an infection or even an injury to your ear. Before we jump into the possible causes of clear ear discharge, remember that earwax itself can sometimes be clear. Earwax naturally comes in various quantities and textures from person to person. When this wax breaks down, it can turn into a clear to yellowish or brownish and odorless discharge. This can happen without any underlying health concern. However, if the discharge truly isn't earwax, it might be caused by several conditions. Firstly, swimmer's ear, also known as otitis externa, is an inflammation of the outer ear canal that can happen not just from swimming, but also from bacteria, fungus, or a virus entering the ear canal. If the skin inside your ear is injured, or if moisture gets trapped, it can provide a perfect breeding ground for these organisms. Symptoms you might experience include itching, pain, redness, clear discharge, swelling, and discomfort that can extend to the jaw area. Next, we have eczema or atopic dermatitis, which might affect your ears, causing them to itch and the skin to become red, cracked, dry, and scaly. Just as it affects other parts of your body, eczema can break down the skin barrier in your ears and cause a clear discharge. The treatment will focus on the underlying cause and might include avoiding triggers, using steroids, or taking antibiotics if an infection is present. Another cause is the presence of a foreign object in the ear. Kids are particularly prone to this, often putting small items like food, beads, or toys into their ears, and adults aren't exempt from this, especially when using cotton swabs. Such objects can lead to infections or injuries in the ear canal, and the discharge can range from clear to bloody or even pus-filled. If you suspect something stuck inside, it's crucial not to try and remove it yourself to avoid further damage. In most situations, a doctor can safely remove it with specialized tools. A more serious possibility is a ruptured eardrum, where the discharge is a result of a tear or hole in the eardrum. This can occur due to a traumatic injury, loud noise, drastic pressure changes, or infection. Apart from clear discharge, other symptoms like ear pain, tinnitus, or dizziness, and hearing loss may arise. While a ruptured eardrum can heal on its own, antibiotics may be necessary to prevent or treat an infection, and in some cases, surgery is required for tears that fail to heal naturally. Lastly, there's glue ear, also known as otitis media with effusion. This condition is when fluid builds up in the middle ear behind the eardrum, frequently during or after an infection, or because of eustachian tube problems. The resulting clear glue-like discharge is typically accompanied by a sensation of fullness in the ear, difficulty hearing, ear pain, and noises like clicking or popping. Glue ear is common in children and can lead to temporary or permanent hearing loss if not properly managed by a healthcare provider with potential treatments like antibiotics. Now let's talk about prevention and when to seek medical care. Protecting your ears is crucial. Preventative measures like wearing earplugs around loud noises and avoiding habits like smoking can help maintain ear health. If you experience symptoms like significant ear pain, hearing loss, dizziness, or if there's a persistent or concerning discharge, it's best to consult with your doctor. They can determine the exact cause and the best treatment approach for your situation. We hope this information has helped you understand the possible explanations behind clear, odorless ear discharge and the steps you should take to ensure your ear health. If you found this video informative, don't forget to like and subscribe so you won't miss out on more health insights. Stay healthy, and we'll see you in the next video.